Great. I think we're probably slowing down a little bit if we want to get started.
Okay. Well, let me get started today, folks. Let me just start by first of all thanking you all for being here today. To our the August meeting in the Alliance for Disease Prevention and Response. Obviously, it's been a very busy month, and as many of you know, it's been a very busy day with the federal announcement of boosters. And of course, there's been a lot of stuff over the last few weeks, which is a subject of our discussion today, as we all get ready for getting kids back to school. I've got 3 grandkids, and you know, that's one of those discussions I'm beginning to have with my daughter about my grandkids and their needs about going back to school. So, and we've also had the issue with the Delta variant, the protests, the debates about the legal issues around wearing masks. So today, you know, we're going to talk about, you know, how to reopen schools safely. And what I wanted us to do is first, we're going to hear from some colleagues who've been spending a great deal of time thinking about these issues. And, you know, first we're going to have the pediatricians talk to us about, you know, obviously the PD pods are focusing both on the health and safety of children and youth. And then some school health organizations have come together to respond to the COVID-19 pandemic. And this, you know, we got lots of challenges in this school year. Very different than last year to some degree. We've learned a lot about what happens when we have kids stay at home. We've learned a lot about the needs that kids have around, you know, virtual learning. But what we're hoping to do is, of course, share a little information about the science relating to students, faculty, staff, and families, and then look for some opportunities for collaboration and taking action to help the nation meet those goals. So we're going to accomplish this with a dialogue from Dr. Savio Beers, who's the president of the American Academy of Pediatrics. We're going to follow that by a panel discussion of leaders from the National School Health Collaborative. And that panel will be moderated by Dr. Ann Reed, who's Kaiser Permanente's director of Thriving Schools. And then following this presentation, we'll have a chance to discuss opportunities to work together to kind of help support these efforts. And that'll be led by our own Angie McGowan. So with that start, let me have the pleasure of introducing Dr. Beers. Dr. Beers is the president of the American Academy of Pediatrics. She is a professor of pediatrics and the medical director for community health and advocacy at the Children's National Hospital here in Washington, D.C. She's the founding director of the D.C. Mental Health Access in Pediatrics program and the co-director of the Early Childhood Innovation Network. She oversees the Child Health Advocacy Institute's Community Mental Health Core, which is a public-private coalition that serves as the catalyst to elevate the standard of mental health care for every young person in DC. And she got her medical degree from Emory University School of Medicine and completed a pediatric residency at the Naval Medical Center in Portsmouth, Virginia, and served time in the Navy as a pediatrician, including in Guantanamo Bay, Cuba, prior to joining Children's National. And so now I'm going to hand things over to Dr. Beers, Lee, and she'll provide some thoughts about the impact of COVID-19 pandemic on kids and how school health and organizations can help us make kids safe in school. Dr. Beers.
Well, thank you so much, Dr. Benjamin, and thank you for having me here today. Give me one moment. I just have a few slides to ground us in. Let me get those up, and you all can kind of give me a thumbs up as to whether or not you're seeing those appropriately. Yes, good. All right, I saw some thumbs up from everyone. Well, so again, thank you everyone. And I will talk just for a few minutes. I promise I'm not going to spend a ton of time on slides, but I thought it would be helpful actually first to ground all of us a little bit. I know you all are incredibly well versed in COVID and rates of COVID, but to really specifically look at what we're seeing in kids, particularly right now during the Delta variant, and then just talk briefly about our guidance around the safe return to school, and then happy to take any questions. So, first, I think many of you may have already seen this, but if you haven't, we have a weekly data report on our website that is a collaboration between AAP and Children's Hospital Association that actually pulls data from all the state websites. So to the extent that that data is accurate, this is that it pulls all those things together. And I think I'll show you a couple more slides too, illustrating some of this. But, what we've been seeing just like in adults is that there's a significant increase in cases over the past several weeks. It does still appear that severe illness due to COVID is still relatively uncommon in children, though I think the point here is that a small percentage of a really large number of kids is a large number of kids. So the more children who are infected, even a small percentage, means that we are seeing some very sick kids, and this is very, as you'll see, regionally concentrated. And so that's really been overwhelming some of our health systems. Here is the graph that none of us really actually like looking at. We were feeling very good about where things were back in June, and over the past 4 to 6 weeks, we've seen, again, mirroring the overall cases, just pretty significant increases in the child cases. As I mentioned, we're seeing quite a bit of regional variability there. And again, this is cases broken out by region of the country. And you can see that particularly in the South and the West, we're seeing some really, is where we're seeing the most concentrated increases, which again, I don't have to tell you all this, are also areas where immunization rates are lower. Now, here's the good-ish news. This is the number of vaccine recipients under the age of 18. Those numbers are increasing, slower than we'd like to see it, but still increasing. And I think, that speaks to the hard work that all of you are doing and all of our members are doing. This one actually shows us a little bit more clearly, and actually this one gives me a little bit of hope, particularly when you look at the chart on the left of your screen as you look at it, where you see the first dose, and you can see the rate slope of increase there is starting to pick up. And I think this does speak to the fact, one, people are recognizing that COVID can be significant in kids. I think, and particularly in harder hit areas. Two, and pediatricians really are trusted messengers, and they are working overtime to get this message out to their patients and their communities, and frankly, sometimes at great personal risk. We're hearing reports just today about members getting spit at school board meetings. So this is they're doing this at great risk, but they're doing it, and I think their role as trusted messengers really is starting to make a difference, as is the work all of you are doing. And again, this is just a geographic breakdown of adolescent vaccination rates who've received at least one dose. And again, we're seeing some of the same regional variability. I know this is no surprise to any of you, but I think it's powerful to see it in graphic. So kind of getting to the question that I was asked to really come talk about briefly is what about school? We're seeing these big increase in rates for children. We know that Delta is more contagious. And so what does that look like for return to school? And I think the bottom line and the key point is really the headline here, which is that all policy considerations for school plans should start with the goal of keeping students safe and physically present in school. I think we have learned over the past year that we can do this, that there are ways to keep kids in school safely, and that this needs to be really, I personally think, one of our highest priorities. Our kids have really borne the burden of the pandemic over the past year, and many of them, over 50% of them have been in fully virtual school for over a year. And so we need to all work together to get them back. And so these are really sort of we can share the link for you of this guidance. This is actually, we have at AAP published actually a number of topics of interim guidance related to COVID-19. And we review each of those pieces of guidance every 30 days to see if there's new evidence that would require updating our guidance. And so our Safe Schools guidance has actually been around for about a year. year. We do review it and update it pretty regularly. And this is our most recent update, which does take into account Delta. So, and the sort of key takeaways from this, aside from the top line, are that the best and most important thing we can do, again, I know I'm talking to the choir here, but all students and staff who are eligible for a COVID-19 vaccine should get vaccinated. We also need to make sure we've seen big dips in immunization rates for routine immunizations and in well visit. So it's really important for kids to, the last thing we want is a measles outbreak on top of all of this. And so we need to make sure kids are getting up to date with their pediatrician on all their routine childhood immunizations as well. We do recommend that children ages 2 and up wear face masks, regardless of whether they're vaccinated. And our rationale behind that is several fold. One is that we, as you saw, we still have pretty high percentages of kids over 12 who are not yet vaccinated. None of our kids under 12 are vaccinated yet. And so there's still a lot of kids in the school who aren't vaccinated. And we need to, for the sake of keeping them healthy, but also for the sake of keeping our schools open, as we're already seeing some schools are closing because of outbreaks, it's important to decrease spread of COVID within the schools. I'll take a moment and pause and just mention, the question I get all the time is, when are we going to see vaccines in for kids under 12? I wish I knew 100% for sure. I think we're hopeful it's going to happen sometime this fall. We certainly have been, asking strongly the FDA to approach authorization of vaccines in young kids with the same urgency that they did in older children. And I think our experts really do believe that the data is there to make a decision about whether vaccines can be authorized for kids at least ages 5 to 11. And we believe that it will be authorized. So we'll let you know as soon as we know, but our hope is soon. And then I think the other really key point is that when we talk about precautions for keeping schools safe is really focusing in on this concept, which again is nothing different for any of you, but this concept of the multi-layered approach. Kids are going to pull their masks down, things are going to slip through. So if you have this sort of multi-layered approach of protection, we really can keep schools very safe and keep them open. And so that's vaccination, universal mask use, distancing where the space allows, routine testing, ventilation, cleaning and disinfecting. If we do all of those things, we've seen schools continue in person, even in areas of very high spread, pretty successfully. And then I think also just recognizing that as students are returning to in-person learning, there's going to be and even those who've been in in-person learning for a while, this has been a challenging time. And so schools really need to be prepared to offer the support for children and families' mental and behavioral health, as well as any educational needs or catch-up that they may have. And then I think, we can't talk about this without acknowledging that there are tremendous disparities. We're seeing this in, across a wide variety of ways, between public and private school systems, as well as different school districts, even some of the same schools within the same district. There's been tremendous racial and social inequities. And a lot of this is impacted by long-standing systemic racism and other really significant structural issues, things related to school funding and quality of school buildings, resources for the teachers. Our children who are growing up in families with lower income also are suffering disproportionately from things that economic security, food security. Many of them are suffering disproportionately from grief and loss. And so I think it's really important to recognize that in order to really achieve successful return to school for all students in an equitable way, it means some schools and some districts and some communities are going to need more resources than others. And we need to prioritize making that happen. And so with that, thank you. And that was a quick run through because I know we want to have some time for questions. I'll take my slides down and then open it up for a few questions.
Thank you very much. I appreciate that, Dr. Beers. Let me ask a couple of questions and we can go to the audience for any questions. Obviously, one of the things we want to do is get more pediatricians involved, and a lot of our members here are people in this alliance. Certainly have organizations that that are involved in health and public health. How do we get those organizations or individuals more linked to helping people get linked to their pediatricians?
Great, thank you. Yeah, a lot of different ways. So first of all, actually, I can see on the board, we've got a lot of our AAP team here on the call, so you can definitely reach out to them or me. So that's one way, but I think there's a couple other things, on both our aap.org website, but also on our parent-facing website, there's quite a bit of information, both for pediatric and public health professionals, but also for parents about getting in to see your pediatrician, about the importance of getting in to seeing your pediatrician. We have a campaign that we've been running for a little while called Call Your Pediatrician. We've got some social media resources around that we'd be happy to share, and we're very soon actually to launch a new PSA, actually, which is really great, PSA about building confidence in the COVID vaccine, but also encouraging families to get back to see their pediatrician. So those are some things as well. But I would also say, to the extent that organizations do work locally, reaching out to their local pediatricians, to their local school boards, and really providing support and engagement there. I think, I think all of us in public health are feeling pretty beleaguered right now, and I know for sure, hearing from my pediatrician colleagues, that they are feeling really beleaguered, and particularly those who are working in areas where there are higher rates of vaccine misinformation and hesitancy. And so, even just reaching out and providing some additional support and telling them that you've got their back and you're there with them, that probably goes a long way too.
The trade-off, I think, that we're all going to have to make, I'm making it now as I talk to my daughter about my grandkids, when they have an option to go virtual or go in the classroom. How does one think about that as part of balancing the other needs that child has, versus, staying at home versus going to school, and the risk at that school? Yeah. And I'm talking about kids who are not yet at the age in which they can be vaccinated.
Yeah, no, it's a great question. I mean, and I think it's something that as public health professionals, we have to do all the time, right? Is balancing different risks. And I think, we continue, I mean, our experts continue to look at this. And I think, there's a couple things to consider. One is that, while children can get quite ill from COVID, and we want to do everything possible to prevent them from getting COVID, their risk does remain much lower than older adults of having severe illness. So that's one important piece. I think the other important piece, and this is, in some ways this is so hard, right? Because if schools are implementing all the recommended precautions, the risk of spread in the school really is low. And we've seen schools, as I said, very successfully return to in-person learning with good precautions, even when rates are high. The challenge, as I know, is for families who are living in places where the schools are not following those precautions, and that is harder. And so I think, for parents to follow their own precautions as well. But I think also, and we talk about this actually in our guidance, is that we have seen really concerning impacts on children from the past year related to lack of in-person learning and education. There's been wide variability in the quality of virtual education, and there's been wide variability in the engagement that children have in that education. And so I think we're already seeing impacts of those tremendous disparities, and we're already seeing pretty significant impacts on kids' mental health from any wide variety of things, but social isolation is certainly one of those. And so I think our general feeling, and we talk about this, is that in most circumstances, the risks of not having in-person education outweigh the risks of exposure to COVID, assuming that you're following good safety precautions. That was a long answer because it's not always easy, but I think that's, those are all the things to consider.
No, let me ask one, and then I can certainly go to our colleagues on our alliance here. And finally, for me, let's talk about long COVID in kids. What do we know about long COVID in kids?
Yeah, this is worse. So it happens. We're still learning. In fact, actually, even in my own institution, Children's National here in DC, we're just joining a large research study looking at the impacts of long COVID in children. But we, again, it's a small percentage of kids who get COVID. Some of the more recent studies are around 4%, but that's still a lot of children. When you look at the absolute numbers, and we're seeing that kids can have impacts that last 6, 9+ months. We're still following some of them, of course. Impacts on cardiac function, lung function, neurologic function, the sort of brain fog that people talk about with long COVID. Kids get that too. I actually just heard from a pediatrician colleague who has 4 kids actually. 3 of the 4 of them got COVID before the vaccine was available, and one of them has for 6 months now been suffering from long COVID. Can't exercise without her heart rate going so high that it's dangerous. And so we are seeing it. And I think that's another important reason to, it's a small percentage of kids, but it does happen, and it's preventable by preventing COVID. Thank
you. Are there any questions? I know I saw some comments from some folks in the box, and we'll let folks just read those, but there are any other questions? Maybe just use the hand raise function.
We have one question from Annie Reed, so I can let her jump in.
Thank you.
This is good practice. Oops, to see if I can make my Zoom work. Hi. Hi, Dr. Beers, Annie Reed from Kaiser Permanente. And I live and breathe this all day. So I don't know, it's really good to hear from you and to get your perspective. I'm just curious about, there's been a lot made of like the Swiss cheese model and how to make sure we've got sort of these layered approaches. And what is the most recent evidence saying about which strategies are most important? Part of this is personal because I have friends whose kids don't have windows in their kindergarten classrooms, and just like, they're considering moving their kid, and so just curious about sort of how you're thinking about that at AAP.
Yeah, no, thank you. It's a great question, and as you might imagine, it's a difficult question to answer with pure certainty, because it's not like we can do randomized controlled trials of So a lot of this is observational, sort of looking at I think our general consensus is that vaccination and masking are the 2 most effective measures. Ventilation is important, but I think if there are classrooms without windows, if the HEPA filters have been inspected, and so I think there's some detailed guidelines that talk about what some of the best practices are there. So just like anything, I mean, outdoors is better, but that's not necessarily practical. And so you're often then weighing, I mean, it's personal for me too. I can speak, both of my children go to DC public schools. Neither of them go to school in buildings that have been what they call modernized. And so they are in old cramped school buildings. And so I understand, but I can say personally, I feel comfortable with my kids there knowing, I'm fortunate to have children who are old enough to be vaccinated, but they're vaccinated. And in DC, we're doing universal masking, and they've done updates of the AC and the ventilation systems to the extent that is possible within the old building. So I think those are, and then of course, I guess actually the other piece is just good symptom screening and availability of good rapid testing and contact tracing procedures, because that does make a big difference too. So catching these things early, catching it early, so that you can appropriately quarantine.
All right. Well, let me. I've got two final questions from our members here, and then we're going to try to go into our next panel. And I know Lee's going to be here a little longer, so maybe if we have some more questions, we can catch her later. So Lynn Silver, and then Janet Hamilton.
Thank you, George. I'm really happy to see AAP doing this. I'm a pediatrician too. We've been coordinating the Safely Opening Schools project in California that's been working on promoting school testing. And in the spring, we saw very low positivity rates, like 0.1%. And we actually saw almost no false positives with rapid testing, which had been a concern before our experience. But now we're seeing, just in the last month, very significant increases in our schools on positives in the screening that's going on. And at the same time, over spring, we saw this huge decline in interest in screening. I think not just in California, but across the country, because rates were going down. At the same time that this huge bucket of federal school testing funding hit. So we had like interest going down, funding going up. And we're struggling now to reignite the interest in the schools in getting both testing and screening activities restarted to complement masking, particularly in elementary schools where the kids are still unvaccinated. Do you think, is AAP going to take any kind of stronger position for not just testing, but screening of the unvaccinated as Delta continues its spread? I think for at least the next few months, that might be important in keeping the return safer. We're seeing some worrisome situations here in California in some districts.
Yeah, it's a good question. I mean, I think our experts continue to meet and talk about this. I mean, to your point, it has been an important part of our recommendations, but also, I guess if you're sort of prioritizing, it's like in the next tier down of, symptomatic. I mean, I'm talking about asymptomatic testing. Of course, symptomatic testing is essential, and that's essential. So it's a good question. I think our experts are continuing to look at it. They haven't changed anything yet, though, we have a weekly executive committee meeting, and I may hear differently tomorrow. So, but I do think, and I think I also would say your point is really good, is that there are now good federal resources available to schools, and so why not take advantage of those, because it is an extra layer, and as you point out, it's the false positivity is I mean, it's a concern, but when you put it all together, it hasn't been a major, that's not the thing that is driving schools shutting down and quarantining. It's kids actually getting sick from COVID. So have to look at that. But so thank you. Yeah. So bottom line is, no, we're not recommending any current changes to the recommendation, but we're continuing to assess that. So.
Thank you.
All right, that was both of them, right?
Sorry, Georges, this is Janet Hamilton from CSTE. Do you mind if I ask my question?
Oh, Janet, yes, please go ahead.
Okay, great. Thanks so much. So Janet Hamilton, CSTE. So I represent epidemiologists working in state, local, tribal, territorial health departments, and really appreciated your overview and also the work that AAP is doing to really help hold up these critical public health messages. And, I was wondering from the AAP's perspective, what your thoughts might be on considering something like handouts for parents, like we do one-pagers for vaccines, around masking, potentially encouraging masks to be handed out when people visit a pediatrician's office, maybe a reimbursement for counseling on masking. I just feel like as a parent too, it's been really hard to see such a basic thing become so political, and in these broad conversations it's really hard for people to tune out, and but those quiet conversations that pediatricians have with parents around all kinds of things, I think still remain very effective. And I'm just wondering if AAP has considered something along those lines, and or how we could collaborate to move something like that forward. I just feel like it's also parents that have made a big difference in terms of changing some of the recommendations that schools have made. When parents get upset enough, then schools listen, and maybe we're missing an important opportunity to really educate those folks and how we can maybe work in that clinical setting to do some of the things. As you mentioned, vaccines are the most important thing, but masking has become such a critical component for another unvaccinated population, those who are too young to protect themselves.
Yeah, no, thank you. And I guess I'll start by saying I share your frustration about how masking has become so politicized, and it's also frustrating because it's this like safe, simple intervention. And the more time we spend, in this space trying to sort of convince people to mask, the less time we have to spend on working on all these other sort of really important things. And so it's just on so many levels. So those are really good questions. We actually have some materials already, like on our healthychildren.org site and around masking. We have some different other toolkits for our pediatricians. I mentioned some of the PSAs, but I think it's an interesting concept actually, and we can kind of take this back to the team about, maybe there's now a need for a toolkit for school boards and parents and community advocates. We have toolkits for pediatricians about different things in their practices. We have, patient information about masking. We've done some social media stuff recently, just in the past week about masking. But that's an interesting idea, let's rally all of our resources here. And I think we'd be happy to kind of talk and partner on these things. I think also, we'd love ideas or how to partner on it. I think also I should say, this is another place where I didn't mention as much earlier, but our school nurses can be so impactful actually, and making sure that we're continuing to work together with them to make sure that they have those tools as well. So, and we can certainly share what we do have, but then there's always opportunities to build on that. So it's a good idea.
Yeah. And just real quickly too, I know when pediatricians now will ask certain questions about like, do you wear a bike helmet and some of those other things of the child. And so is there a way to incorporate this? And, quite honestly, masking is probably great during respiratory season, and regardless of COVID-19. And so how can we maybe take a long-term approach? I do realize, physicians' consultation and time is precious time. And so how do we think about these really critical things from that broad perspective? There's only so much that can get added onto those questionnaires, but such a critical thing. So would love to talk more with you. Thank you.
No, that would be great. And your point about the financing, I didn't touch on that, but your point about the financing is spot on. I mean, it's one of the things that's straining our pediatricians right now is that they're spending, they want to do it, but they're spending a lot of time with their patients talking about all these issues, and that those visits take a long time, and they're not, they're not getting compensated for that, and they need to be able to pay their staff. Yeah.
Well, thank you. In the interest of time, Jose Ramon, if you could put your question in the chat, we'll come back to it. I promise I won't lose it. And because I need to go on to this panel and just bring on Dr. Reed and her panel.
Great. Thank you, Dr. Benjamin. All right. Well, thank you so much for the invitation. And Dr. Beers, it was so great to hear from you. And I think Mary is teeing up the slides here. So I think a lot of what Dr. Beers was talking about is actually a great segue into what we'll be discussing here with the panelists here. We've got even the executive director of National Association for School Nurses, Donna Mazik, which is great, as well as Chelsea Prox from American Federation of Teachers. And before we do that, I just wanted to sort of tee up the conversation to let you know a little bit about what we're doing at Thriving Schools at Kaiser Permanente, and how we, in collaboration with the National School Health Collaborative, are really, I think, in parallel in some ways with what you're doing at the Alliance, looking at how to move from sort of this rapid response to a transformational effort to support health in schools. And what I'll say is that I want to make the point, obviously, everything that Dr. Beers said around COVID is so important, and also want to make the point that we are really focused on attending to the many different dimensions of health as we think about going back to school. Everything from, of course, the physical health concerns, mental health and social health as well, social drivers, and I'll get to that in just a moment. So why do we care about health in schools at Kaiser Permanente? I probably don't need to say this to any of you, as this is definitely the choir, as Dr. Beers said, but obviously we know there's a reciprocal impact between health and education. Health happens in schools, whether virtual, in person, or a combination of the two. And at Kaiser Permanente, many of our members are actually in or adjacent to schools every day. So at Thriving Schools, we work to, and you can go to the next slide, Mary. Thank you. I just want to really make the point here that, our focus is not just on the students in the building, which are obviously enormously important and why everybody is in schools in the first place, but we're also really thinking every day about the health of the teachers and the staff in the schools, and that the adults in the building are equipped to make to be in healthy environments and make choices for themselves that attend to their own needs as they serve the students in the building. As I mentioned, we think of health very expansively. Access to care is one of those things, but we're also thinking about the conditions around physical health, mental health, social drivers of health, and equity and racial justice. And we work really in three sort of different ways to provide intense support to schools, to scale our efforts to schools across the country, and also on really in meetings like today to really bring attention to the critical intersection of health and education that I'm sure you're all already very aware of. Otherwise, we wouldn't be here. So we early in sort of the trajectory of COVID, we established Kaiser Permanente, brought together a group of some of our national school health partners. And we have grown since, and in fact, I'm happy to say that AAP is actually now a member of the School Health Collaborative, and you'll see a list of the organizations there on the right-hand side, which has grown since even we recreated this slide a few weeks ago. We initially came together really to think about what is happening in schools. How can we support them in their needs to address health as a critical input for academic success? And we created a webinar series. We developed a playbook really focused again on those multiple dimensions of health as schools were getting back underway in their various modalities. And then we said, this is really useful when we all talk to each other and try to identify ways that we can really sing from the same songbook and have the same message through our different stakeholders and through our different lenses. So we formalized our group into what we're calling the National School Health Collaborative. And I'd love to invite all of you, and I think Mary's going to be able to put this in the chat in just a moment, but we're having a big event on August 30th that will be the first sort of release of a report that we've done in collaboration with Child Trends on equity in school health, and it really looking at sort of the ways at the federal level that health in schools is organized and what the implications for equitable outcomes and prioritizing equity, both academic and health are. So we'd love for you to join us for that. And that actually is going to launch the development and the process for what we're calling our 10-year roadmap for healthy schools. So we are recognizing that that a part of the reason that we're in this situation where schools in many places around the country have been closed for so long and are just beginning to reopen for in-person instruction for the first time is because of the siloed nature of health and education. And if we are really going to, poise ourselves to be in a better situation moving forward, where health is a given in schools and not an anomaly or an afterthought, that we need to really come up with a horizon that we're aiming towards collectively and figure out how to get there. So that's sort of the next step in our process. We're at the beginning stages of launching that plan and would love for all of you to be engaged in that process in some way, shape, or form, and happy to talk about that. As we move forward. So before we move to our panel, which is I think the sort of meat of the discussion here, I just wanted to sort of give a little bit of context around what is happening in schools, aside from some of the issues that very important issues that Dr. Beers spoke about. Obviously a few weeks ago, things seemed pretty likely to be situated for a good, strong, safe reopening of schools across the country. But as Dr. Beers spoke about with increasing caseloads, the patchwork of vaccination rates around the country and polarizing legislation around both mask and vaccine mandates, it's feeling a little more dicey. And I won't go into sort of the nitty gritty of what's happening around vaccines and masking, but I just will make the point that, as I think you saw in Dr. Beers' presentation, we have a lot of work to do to get our 12 and older kids vaccinated and to protect the kids who are 12 and under. And that, interestingly, unlike many other vaccines that are compulsory for school attendance, there's no state that has yet required COVID vaccines for school attendance, but 7 so far have forbidden making COVID-19 vaccines an attendance requirement. And similarly for masks, there's only 2 in 10 K through 12 students actually live in states that require masks in schools, and about half live in states that really leave that up to the school districts rather than having sort of universal requirements. So it's a little bit of a wild west out there in terms of school district leaders and school building leaders becoming public health experts. And I'm sure many of you are super familiar with this in your personal and professional lives, but we're creating these interesting public health fiefdoms at schools where they're making decisions in very local ways. And so things are in flux, and I think part of what we're really going to need to make things work at the local level is trusting relationships, which has a lot to do, I think, with the mental health and behavioral health aspect of how we return to this new year, this new normal or new normal-ish, with more security in our relationships. I just want to mention quickly around school infrastructure. I think it's, and I'm sure Donna will touch on this, that we have been insufficiently staffed around health in schools. We have issues around pipeline and having enough people to actually fill positions and to pay them sufficiently. And we've got this giant influx sort of simultaneously of $193 billion of COVID relief for K-12 education, which can be used for a variety of things, including school reopening and social emotional learning and staffing. So districts are scrambling to make plans, and also knowing that this is a 3-year spend down, trying to think about sustainability. And then the last thing I'll just mention around school health, you guys know more than anybody that for most pediatric health indicators, they're going in the wrong direction with the exception of very few. But I think maybe more sort of interesting and relevant to this conversation is just this realization in the general public that schools are public health. The Alaska Chief Health Officer, if you were on the Public Health Communications Collaborative call a couple of weeks ago, said, people don't know who their state public health official is, they don't know who their local public health official is, but they sure know who their principal is, and they know who their teachers are. So I'm really trying to leverage both at Kaiser Permanente and in collaboration with the National School Health Collaborative, including with Donna and Chelsea, who are on the panel today, that idea and how we can really leverage this opportunity. So with that, I think Donna and Chelsea, are you guys on? I'm gonna make sure I don't see her.
Yes.
You're not used to Zoom. Great.
Yes, right here.
Thank you guys. Hi. All right. So I'm so excited to have you on today, and I was hoping you guys could both just give a quick introduction of yourselves and your role and the role of your organization in response to COVID-19. And maybe I'll start, Donna, with you, and then Chelsea, you can take it after Donna's done.
That's fine. Hi, I'm Donna Mazik. I am Executive Director of the National Association of School Nurses. And we've been at the ready to provide school nurses and school health services staff with resources during this time of COVID. It's what we've always done, but it's been ramped up in a different way that we've all alluded to during this time.
Yeah,
Thanks, Donna. I'm Chelsea Prox. I work at the American Federation of Teachers, where I lead the work on children's health and well-being. I apologize in advance if I seem quiet. I'm losing my voice and trying not to strain too much, but I'll lean close to the mic if I can. The AFT has, I would say, at least sort of a two-pronged effort. So both really trying to be ahead in terms of the science, as not obvious from the name, the American Federation of Teachers. It's actually one of the largest nurses unions in the country. So we do take science-based recommendations really seriously and want to make sure that those are available to our school-based and healthcare-based membership. But also probably obvious. Unions are very often in local political fights over not easy to answer questions. And so really trying to make sure that our affiliates are well prepared with evidence-based information so that they can be making decisions and bargaining both in formal ways and around MOUs and other agreements to make sure that staff and students are well protected in local communities as everybody's sort of out in their own making balkanized decisions. We're trying not necessarily to standardize them, but to allow folks to have equal access to good information.
Great. Thank you both. So maybe Chelsea, I'll go back to you, and thanks again for being on, even though you're under the weather. So we'll go easy on you. But what are you hearing right now from your members about what's on their mind as they're going back to school right now?
I think everything that I heard Dr. Beers say and everything I heard you say, Annie, is absolutely spot on in terms of COVID. I would underline that uncertainty is the name of the game. Anxiety is high because the school year that folks were planning for even 6 weeks ago doesn't necessarily feel possible or relevant anymore. And a lot of what we've heard in the last 18 months is, especially from teachers, they feel like they are doing a very difficult job that they weren't trained for. And they're doing their absolute best. They really don't love when people say the schools are closed or, there's been no education. They're like, do you know what I'm doing? Like, I'm trying everything. And this isn't their ideal setup either, right? And so for many of them, the horizon of what, their aspirations in terms of what kiddos deserve and the schools that they want to work in and they really want to lead, it's not clear when we can get there. And I think that level of uncertainty is really frustrating, and the constantly shifting dynamics around how to protect students and how to maximize, equity and good outcomes is really difficult. The other thing that I will say is that I think, with attention, I hear very consistently from educators that they're not just paying attention to COVID. In the last few weeks, for example, I have been asked to help a state affiliate put together talking points for Student Mental Health Day legislation, right? Really trying to make sure that our students are getting excused absences that allow them to best take care of themselves. We're getting questions from reporters around educators' mental health. We are getting, members reaching out, trying to make sure that their teaching assistants whose families are in Afghanistan are well protected and have an opportunity to be on planes. None of this is about COVID. This is about the real people that, educators actually serve and work with, and they're constantly solving all the different problems and challenges that real people come to school with.
Thank you, Chelsea. Donna, can you respond to the same question?
Yes, and I will take that term of uncertainty as well as Dr. Beers' term of balancing risks. School nurses are accustomed to managing infectious disease outbreaks. I mean, it's been that way with flu every season to a different level, of course. But what's been very concerning is the discord around a public health science-based approach to infectious disease. And this COVID pandemic has been something other, and that has school nurses really concerned about this coming school year. There was the height of, vaccines are available for students 12 and older. That's great. This is what we can work with, to plummeting to where we are right now and trying to deal with the Delta variant and not always having agreement on the way that should be handled. And so school nurses right now are really concerned about exposure and how to mitigate that. All of the layers of protection, of mitigation, the strategies that are normal with vaccine being at the highest. We know that in elementary schools that we have a whole student body that can't take advantage of that. And so universal masking, the distance, all of the mitigation strategies that are necessary, the ventilation, school nurses are working with school teams and with partners to make sure that that is attended to. And as Chelsea said, school nurses are going to work with students who have chronic health conditions or mental health problems. Already, they're looking at the issues that students are dealing with. We're teeing up a blog post on grief and loss. And we also know that it's the students and it's the adults. So I once heard a psychologist say during this pandemic that if the adults aren't well, the children won't be well. This is a team, we work together. And so those are some of the things that we're hearing. The routine vaccinations and the lack of regular well visits during COVID have school nurses very concerned. And so about that, medical home school nurses are really encouraging families to make sure they have those regular child appointments that they've maybe missed. Screening tests is another layer of mitigation that school nurses are looking at to make sure that they can keep schools a safe place for staff and students.
Thank you both. And we could, I'm sure, spend our whole time on that question alone and probably this next question, but I want to make sure we continue so that we can get to questions from the group. And I hope it's okay, Angie, if I encourage folks to put questions in the chat now. And as I ask this next question of Donna and Chelsea, and Donna, I'll start with you. We've heard, I mean, today and throughout the pandemic about just the enormous implications for equity. And I think there's no time like the present that we're seeing that play out as we think about back to school. So can you just speak to what's on your mind regarding equity, health equity in particular, and what are your thoughts about how this group can help support more equitable outcomes for health?
That's great. One of the things that's on our minds is the need to pay attention to the data on how students learned or didn't during this pandemic. For those students who learn better in-person learning, that's the majority of them, how are schools going to prioritize what strategies are necessary for all students to take advantage of their education? I think we're also concerned about I've seen various numbers on this, but 15 to 20% of students who did not engage at all, neither virtually or any other way with their education. Where are they? What's going on? And what are the plans to reach out to those students and engage them? And then we believe that school health services is an equity issue in and of itself. Healthy students learn better. And there needs to be the provision and the attention to the health of students while they're in the school building. And so we see that as an issue that needs to be addressed. We do believe that school health services ends up being a program that needs to be part of the infrastructure of schools. So while an infusion of federal funds for opening schools safely has arrived, and while local health departments have been given funds to hire school nurses, we're really talking about whether the programs that would be necessary for students beyond 3 years to be healthy and safe and available for their learning. Those are issues that we really are concerned with. And if I could just take this moment before you go to Chelsea and talk about some of the things we've seen during this pandemic. We know that health and education are linked. We've heard it. We say it. We believe it. But health, I want to just point out to those who already know, but to say that health includes mental health and well-being, and it's not simply the absence of illness. And this is why, from an equity standpoint, school health services needs to be available to students.
Yeah, I couldn't agree more. And I think that's going to be a big part of the work we do around the roadmap for healthy schools is really thinking about how this is really school health is an equity strategy, right? Or it should be. So, okay, Chelsea, over to you.
Thank you. So I think I'll go for a short answer, both to save my voice and because I just get to agree with Donna. So my two-part short answer for equity. Number one, we have to center the students and families who we know to be the most vulnerable. So I can't tell you who that is in your specific community, right? I can tell you about some axes on which you can assess vulnerability. We know that people of color are very often at disproportionately, they carry disproportionate risk and disproportionate burden. We know that people with disability, kiddos who have migrants in their families, even if they are not migrants themselves, even if their entire family is not migrants, the structures that do these young people a disservice, set them up to have worse outcomes. And I think when we place them at the center of our planning, we strengthen all of our institutions. So for example, if you are in a community that has, young Puerto Rican folks in it, placing young Puerto Rican folks who have not had housing and who still have an island that has been under siege and has not been rebuilt at the center of your planning means that you will strengthen your schools for all. This is true for folks who have Haitian folks in their community. If you have Afghans in your community, if you have people who are learning English as a second or third language in your community, people with multiple disabilities and chronic illnesses at the center of your planning makes for stronger planning. The other massive component there is just to add to what Donna said, our specialized instructional support personnel, our CISP, which includes our school nurses, it's also our school social workers and our school psychologists, our counselors, our speech language pathologists, our occupational therapists, our art therapists, where we have them, right? The list is a little bit longer than that, but really our folks with incredibly specialized credentials do not have the kind of job security and retention that we know that they need in school settings in order to make school communities as strong as possible. And that is absolutely a policy issue, but it's also something that we can be taking on school by school and district by district.
Wow, thank you both so much. There's so much to digest there, and I wish we had time for more questions, but Angie, I think our time is up.
It's great. Although if people now want to ask questions or raise hands, that would be great. Thank you. That was a really amazing kickoff, I think, for hopefully our discussion about this. And so exciting to hear about the work that you're doing at the National School Health Collaborative. So thank you, and with your individual organizations. Okay, I know this group is not shy, so I am waiting for hands to go up. But in the meantime, I'm happy to ask, one thing we have together with this group, we have philanthropy, we have those of you working in schools, we have healthcare, we have public health partners, we have those who focus on business and other sectors. What do you all see could be helpful to you to kind of keep this work going over the next year? And we can look to the 10-year plan if you want, but this is your opportunity to kind of tell us how we can be helpful.
I'll go first if I may. So one, I think one of the lessons that I've learned and I keep learning is that health literacy really is not widely shared in this country, and that is incredibly dangerous. I think that we can all do better to improve the ways that we share and construct health information, but also to really deliberately set about building health literacy. And it doesn't, building that skill set does not have to focus on the political difficulty of COVID or masks or vaccines, right? We can build health literacy in lots of different ways and from many, many different perches. So I would challenge this group to really think about how we could add that in. The other thing I will say is that a lot of the time in school health, especially when folks are thinking about taking care of adults, they run to health behavior change. And we really need to be very thoughtful about aligning our suggestions and our solutions with the kinds of problems that we are facing. Educators cannot deep breathe their way into better class sizes. They cannot yogic stretch their way out of a pandemic. Those are fantastic coping strategies, and they are not solutions to structural problems. We have to have structural solutions to structural problems.
That's great. And I would add that part of the structure has to include integration and coordination. So the makeup of the alliance really speaks to all of the players who need to have some level of integration and coordination to make sure students thrive and their families can move forward. What school nurses see a lot of social needs, yet we know that it's the social determinants that are really making a difference in outcomes for families and children. So the housing issues, the income issues for the adults and families. We want to really work more closely. I believe school nurses do that with pediatricians, some of our favorite partners in the health of children, because we know that it's a home and we can actually help families in that health literacy to know that there is a medical home for your child, and this is how this works, and we work together with them. There are other issues and areas of need that we need that collaboration in. And so in a school where a school nurse is encountering families, and I saw Kay's note that school nurses are feeling that stress, but being able to work with, say, AAP or other groups and find out, are there 2 or 3 questions we can ask that would surface some of the issues that students and families are dealing with every day, that we can collaborate together to make sure that we make a difference for them. It is structural, but the coordination and collaboration has to happen.
Yeah, thanks for this question, Angie. This is always a fun question to answer, so I appreciate it. I think echo what both Donna and Chelsea said, and I would just add, I think in health and education, we are all arguably aiming towards the same horizon, and yet we use different language, we use different metrics, we have different funding mechanisms, and I think if we could figure out how to take a more expansive approach or an expansive definition of health, it's not just about health services, it's not just about mental health, it's about sort of recognizing that people go to school, they go to visit, they work in their whole self, and their whole systems come into the school building. And so I think we need to take sort of a more holistic approach to how we address health in schools and really rethink how to break down the silos between health and education. So I think there are a lot of implications for sort of how health providers can think about, I love the question earlier about, the bike helmets that pediatricians ask about, but can we also be talking about attendance? Can we think, get our healthcare providers to think about education outcomes and get our educators to think about health outcomes as the same thing and the same goal, and is mutually reinforcing. So that's one thing. And then for the funders, especially on the call, we are looking for folks to help think through what is the next phase of our 10-year roadmap, and to sort of join that. But frankly, we want everybody to weigh in on the roadmap. So we'd love to find ways to engage this group on that moving forward. So I'm sure we could all think of a lot more ways, but those are the ones that come top of mind for me.
I think that's great. I saw Steve with a question before. Did they answer your question, Steve?
Partially, yes.
Okay.
I'm interested in whether there are other kind of community-based partners that would be especially valuable for schools to have, that are difficult sometimes to engage with. You talked about the health field. Are there other areas where schools really could use partners that could enhance their ability to protect children's health?
Absolutely. Housing comes to mind right away. Students can have some of the most treacherous trips to school just by where they live and where they have to traverse just to get into the building. And so being able to have the agencies, the community partners that impact where they live is important. Transportation is vital. Transportation for students, but also transportation for their families. There's a lot of need for meetings in schools sometimes, and from an equity issue, that can be very difficult for families who can't leave work, because if they leave, they lose because of a lack of the leave time for that. So, I mean, transportation, labor, in many ways, when you look at what makes a town thrive, a city thrive, you look at that page on their website, all of those different agencies and places are really needed to make sure that the students and their families can thrive.
Thank you.
Great. Any other questions for this group? And I'm guessing many of you may also be chomping at the bit to give your own comments and thoughts too. So. Okay, great. Poor Chelsea lost her power, but you're back. We're so glad. So Chelsea, one thing we asked, I think, while you were gone was just if there support that you need from kind of our different multi-sectoral partners to help teachers in the work they're doing. And I think you were gone when we asked that question.
I think Dr. Lee had a great answer earlier, which was partly just to show up and show out and share your voice in support of educators. They very, very often express that they feel under siege and not supported. And those voices are very loud. And that's about, that contributes to workplace stress. So trying to alleviate that by just clarifying right when you are on the other side. And I think wherever possible, providing material support and providing structural support for some of those bigger picture challenges. So I know I saw earlier, for example, a school district that was really trying to figure out how to do lunch outside or school meals outside. Some of making some of those things work is having more hands, right? So can you be that another set of hands, for example, at a school meal?
Great. So let's thank you so much to you all for the panel, and you're still here, so you may also get questions or feel free to ask questions too of our group. But let's go to kind of the group discussion now. And just want to see if anybody has been struck by things you've heard about, things your group is doing, or that you feel as a group we all need to address as we're seeing kids and everyone get back to school. Okay, while you all are thinking, I do have one set of resources that I promised I would share. The Jim Romont Foundation, working with Frank Luntz recently, had a chance to do a survey of parents, kind of asking them about the issues they were worried about with getting back to school. They have resources and pointers as to how to communicate and who are the trusted voices that we may want to consider. So I will put that in our chat feature in just a minute so that you all have it. Let's see, I think I have it here. And so as you'll see, some of the things were really specific language about how we can best communicate with parents. They really wanted to hear first about safety, about how to make sure that we were being efficient. Anything, as you all can guess, political or of partisan in nature really turned a lot of people off. But I think they have a lot of great comments on trusted messengers who were pediatricians specifically, state health officials, and local education officials. So just ideas, and the links are here for you, and I think have some great input for everybody as you're trying to think about what we might want to do. Okay, for others, how can we all, with everything that we've heard, do you have thoughts on kind of what we as a group could do to kind of support all of these efforts that we heard about from our partners today that we need to be working on to get kids back to school safely and make sure the schools, their staff, and our communities are healthy? And Lee, I see your hand. I will turn it over to you.
Good. I'll launch us off, I guess. But I think, and actually, I think all of us have really said this in one way, shape, or form. But I think children and families and the people who take care of them, like pediatricians and teachers and school nurses and school staff, I think, in so many ways, not fully, but in so many ways have really been an afterthought in this first part of the pandemic. And I do think there's an important opportunity now for us to really work together to raise, just come together and raise the awareness of how kids are being impacted. Not just, sometimes we do, and I think the panel before me spoke about this so nicely, we talk about the infectious impacts of COVID, which are really important, but there's all these other impacts as well, which we weren't set up to deal with well coming into this. And so I do think if we collaborate together, there's some opportunities to really try to make things better for the long term. But it will, someone shared with me once a long time ago, he said, the reason you can't ever get any traction in child health is because you have so many different priorities. Like the seniors, they have one priority and they focus on it. The child health community has so many priorities. So maybe this is our time to really, really focus in on supporting children and families as we move forward.
Thank you. Great thoughts. Others on kind of this broader question? Okay, well, while you all once again are thinking, one thing I noticed earlier that people were suggesting were specific tools and resources that they thought might be helpful as we're moving ahead. I saw a number that were listed in the chat feature, things like toolkits, talking points, etc. Give people have a chance now. Why don't, if there are other things you think that you could use or that would be valuable, why don't you just add them to the chat feature? You're welcome to raise your hand and tell me also. And that's something that we certainly can share with the group once we're done too. And I'm guessing with the people we have here at the table virtually, that we probably could figure out how to get a lot of them built or put together. So feel free to also think about that. How about others? Are there things that your groups are doing that you want to share with us around school health or challenges that you're facing? Okay. Dr. B, did you have a question?
Yeah, let me just ask the question. So at some point, they're going to, probably in the next few months, authorize the vaccination of little kids under the age of 12, but probably still school age, 5 to 12. How are we positioned to take care of those kids and get them vaccinated and then validate that they're vaccinated? And how are we going to deal with the resistance that you're going to get from some families?
I mean, I can certainly start, but I'd also love other people's input too. You know, I think you get back in so many ways to this concept of pediatricians and others, you know, school nurses, teachers being trusted messengers, because I think, you know, we've certainly seen this with adolescent vaccinations, is that parents have questions, and that's great. I mean, they should have questions. And I think they want to talk about those questions with people who they trust. And so I think, you know, making sure that we're doing our best to really try to open up those opportunities anywhere and everywhere. I mean, I think, you know, certainly we're working to prepare our pediatricians to do that. We've got a lot of resources that many of them have already really started using for 12 and up. We have a partnership with the White House where we're working to integrate questions about the COVID vaccine into school physicals, so that, you know, that's just sort of a routine part of that when you're coming in to get your vaccine for, you know, soccer or whatever, that's a routine question that's less for the little kids, but it's also, you know, it starts the conversation for the family. But I also think, you know, again, some of these partnerships between pediatricians and schools, where maybe a school can bring pediatricians in, you know, bring a pediatrician or a nurse in to talk about the vaccine to their you know, to their parents at back to school night, and just have a little, you know, question and answer table to answer individual questions. So I think, you know, lots of different things, but I do think, you know, parents, they're going to want to ask questions, and that's right and fair and reasonable, and they're going to want to be able to talk to people who they trust.
Anybody have a sense of how it's going to work out? You know, so normally what happens in the real world before COVID, you know, we had back to school fairs, we had vaccination catch-up experiences. What do we think that's going to look like this fall when you know, and what do we think the spin? So first of all, what do you think it's going to look like? Secondly, what do we think is the negative spin-off of those fairs as you're trying to catch kids up on their routine vaccinations? How many parents we think are going to be afraid that we're going to try to slip in a COVID vaccine?
That is more real than we care to believe. I just heard someone say that parents, even though there is no authorized use for COVID vaccine for children under 12, that there were some parents who were afraid that healthcare provider was actually making a switch from whatever the routine vaccine was. So that's a real thing. I think we do, as Dr. Beers said, we keep leaning on the trust. The trust is there. And being able to, even in my mind, I've been talking about the vaccine concerned. You know, sometimes we'll give a label that can actually cause us to, as providers, as helpers, to push people into a box. They have questions, let's answer questions. Let's bring together the people who can answer those questions. I will say that there have been vaccine clinics for COVID vaccinations that happened at schools, because school buildings happen to be a place where there is some familiarity, and families will do that. Not in the numbers that we've wanted, but again, that's the collaborating partnerships, being able to do that. It's been challenging, of course, because local health departments, who are great partners in this, have been really busy on the COVID-19 responses. I think those clinics will still happen. They're happening now.
Great, thanks. I see Jose Ramon Fernandez Peña has his hand raised.
Hi, yeah. I frankly think that we have been shy up to this point about going for a vaccine mandate. And I think that it's high time that we go there across the board, understanding all the challenges and all the skepticism and all the reasons why people may have a legitimate concern for not being vaccinated. But we have stayed a bit away from that, and I think we need to go there. And perhaps the moment is going to be after the FDA finally does the final approval for use, not the emergency use authorization. But without going there, we're going to continue to waste time around about mask mandates. The conversation does not need to be about the use of masks. The conversation needs to be about vaccination. And I think that that's something that many of us in many areas are going to have to go to together. I appreciate, Dr. Beers, the fact that you have in fact signed that letter talking about this situation, but we have to be more clear, and we have to take the heat that is going to come with it. Otherwise, we're going to let it continue to be a political game. And that is trumping the health conversation. And we cannot allow that to continue. If this was an outbreak of mumps, or if this was an outbreak of measles, we would not be so shy around it. So I think we just need to take the bull for the horns and go for it in a reasonable, logical, thoughtful way. But it's high time we go there.
Yeah, we signed a letter with the COVID Collaborative, asking for mandatory vaccinations for education, and we did it for the healthcare workers as well. This is APHA. It's gonna be a nightmare until we get hands around this disease, and it continues to evolve in if you're a scientist, very interesting ways. If you're a citizen, very frightening ways.
But that's why we can't afford to not go there.
And at a minimum, we can start with the school mandates. Even those are so in such wide use already for all the other illnesses. Can we campaign more actively to start with school mandates for every kid and every staff member who's eligible until we get wider?
Well, it's fascinating how the politicians who are all demanding that we gotta get our kids back in school are now putting every roadblock in the way to keep us from actually getting kids back in school. And if I thought these were scientific decisions, I would give them credence, but they're not. As you know, most of them are political decisions. And it's just a shame.
Yeah, I'll just add, I think one of the challenges with vaccine mandates in schools, not that I disagree with the premise at all, but just one of the challenges is just how local, by design, how school districts are really local control. And so there's just such, for every, I think there's like an adage, for every of the 40,000 school districts across the country, there are 40,000 different ways of doing everything. And so it just makes it, to only go the school route, I think it makes it hard for that reason. I don't know if, others would disagree with that, but.
No, it is. I was fascinated to see that the folks in Texas are now looking at clothing, dress codes as a way of getting around the mask mandate. I always said that if you link wearing masks to wearing pants, that it'll probably solve the problem. So it seems like someone finally heard that, and we'll see if that works. because I can't imagine them undermining the dress code in their schools. But who knows? I mean, they've done some really weird things lately.
Anna, I see you have a hand up.
Just really quickly, I agree that it would be great if all the districts, passed a mandate to make vaccines mandatory. I think there's a big fear too on just at the local level on getting sued on the basis of free, appropriate public education on FAAP as a basis of lawsuits. And so I think that's something that school boards are really scared of, right? Because that takes money away from kids, right? Every time we have to pay out a lawsuit, and our kids are really vulnerable right now. And so I think that's something that school districts are grappling with, and really want the states to make the call. It's just really hard, and we get caught up in the politics as opposed to all of us kind of being on the same page on what's best right now. But I think everything being pushed at the local level, like testing cadence, everything feels very overwhelming for school districts right now.
Dr. B, I'm not sure if you're on mute, if you're trying to.
I think Ernest is on the call, who's the president of the American Nurses Association. I don't know if he had any thoughts.
Sorry, it took me a while to log on. No, I agree with what everyone has been saying, and this is quite a challenging issue and a challenging time for us all around. And I firmly believe, though, that we're headed in the right direction as we continue to try to push for the vaccine mandate, the mask mandates, and everything else. And I think I would have thought that with the governor of Texas contracting COVID himself, that perhaps there would have been a change of mind, but apparently not. So, but no, I'm in agreement with everything that that everyone has been saying.
Yeah, not as long as he has to take those antibodies that he really didn't.
Yes, yeah, yeah. That's the other thing, is that they fail to realize that when they get sick, they have the opportunity to to advanced healthcare that a lot of people don't have, and they fail to to really see that picture and to take that into consideration.
Let me pick on one other person. Thank you, Ernest.
Sure.
Mike McDonald's. You folks, your community group in RAC, any thoughts that you might have around getting data and trying to get this at the community level, try to support these efforts? You may not have heard me. All right. Any other thoughts? Back to you, Angie.
Thanks. So no, I think we may have gone through so many issues. I looked over our list of questions and I think we've touched on all of them, which is great. I've heard a lot of great opportunities for collaboration here today. And so I hope we can continue to find ways to meet and to figure out how we can support each other. I really want to thank our partners from the American Academy of Pediatrics, so Dr. Savio Beers from the National School Health Collaborative, so Annie Reed from Kaiser, Chelsea Prax from the American Federation of Teachers, and Donna Nisick from the National Association of School Nurses. I think you all did an amazing job of putting out all the issues for us, pointing out both what the challenges are we're dealing with right now, as well as those more long-term issues that we're going to have to face. And so I hope that we can all keep sharing stories and lift up examples we see that are working, so that hopefully we really can get kids back to school safely, learning and in good health and well-being over the next year or so to come. So thanks so much to everybody. If you have other things you'd like to share with folks, feel free to please send those to me and we'll send them out in the notes from the meeting. We've also recorded this, and so we'll be happy, we'll do a transcript of it, but we'll send it out to everybody if you'd like to share it with your colleagues too. I know with August, there's a lot of vacation, and as we mentioned earlier, CDC also just announced their boosters. So I think some communications folks might be busy dealing with that at the minute, but great conversations. Thanks to all. And we'll certainly look for joint communications and advocacy. I know David just mentioned and think about other ways to work together. So feel free to send them to me and I'll make sure the group gets them. Thanks to everybody. And our next meeting will be September 15th. Tom Frieden will be joining us and we'll look forward to talking to you all then. Have a great rest of the summer.
Thank you.
Bye, thanks.